farmer from rural Maharashtra. His hip pain had become unbearable. He was not able to walk. He needed a surgery, but he couldn't afford the surgery because he couldn't afford to be in the hospital for 2 weeks. His crops could not wait. His family could not uh, tolerate his absence because it would be a big economic burden for them. Eventually, he underwent a surgery in which the recovery was long. He was off the work for almost a month. He missed his entire harvest season. In short, his hip was cured, but he lost complete 1 year of earning because he could not do his farming. So imagine the same patient underwent a surgery, a hip replacement surgery, going back home the next day and going back to the field in 7 days, in a week's time. So this is the magic of direct anterior approach, total hip replacement. And today I will tell you more about it. So this, along with robotics, is not just a economical change for India. It's also a big boost to our patients because they can go back to their activities. Now, hi, I'm Dr. Rohit Luthra. I just gave a small introduction. I am from Pune. I'm an orthopedic robotic surgeon, and I practice. I was born in Nasik. I come from a humble family. My father had a shop which sold batteries and inverters, and we had tough times that time. But I was always so these tough times and challenging times inspired in me to see how technology is changing lives and how we can change technology can change procedures. So as I grew, I pursued being an orthopedic surgeon, and during my orthopedic training, I saw how technology was changing things in the West, how robotics and technology, the advances, the robotic navigation was changing that time, and that inspired me to to use robotics in my field. And so I was later on trained in Germany, France, and other European countries. Then at that time, I got the opportunity to be selected as an employee in these countries. They offered me good jobs with better perspectives, more advantages. But somehow my heart belonged to India, and I came back with the purpose to serve my country, and that's how I'm here today. Now coming to the demographics, so how things are changing. India is now the arthritic capital of the world. We have the largest population in the world, and our population is changing. We have problems like hip arthritis, we have avascular necrosis, and trauma. So this is causing a lot of handicap in the patients who are unable to walk. So this is what we're seeing, and roughly around 1.5 lakh hip replacement surgeries are done every year. Now, when these surgeries are done with conventional approach, the recovery time is long. So a conventional approach means the approach in which the surgeons do the surgery from behind, so in which they're approaching the hip from posterior or lateral approach. Here, the major muscles are cut, and because these muscles are cut, the recovery time is longer, there is more bleeding, the patient is in the hospital for 4 to 5 days, he's allowed to walk with a walker for 1 month, he cannot go to work for 2 months. So this is the main problem which was happening. Now, let's run some numbers. For example, if a patient who's staying in the hospital with a conventional approach, roughly 4 to 5 days, and if we compare the same patient undergoing a hip surgery with direct anterior approach who's staying in the hospital for only 1 to 2 days, so you're saving around 2 hospital bed days per patient. So if you calculate 2 to 4 bed days per patient, so if you calculate over 1.5 lakh surgeries over a year, that's around 6 lakh patient bed days saved. So this is not just cost saving, it is capacity generation. So with this approach, we'll be able to treat more patients, especially in India where the healthcare is burdened with a population. The general hospitals or government hospitals are full of patients. They are on the long waiting list. So this is very, very effective. Now coming to some income generation. For example, if a patient who undergoes a surgery in which he is undergoing conventional surgery, he will be off work for 2 months, that is 8 weeks. And the same patient, if he undergoes a direct anterior approach surgery, which is a short duration, he can go back to work in 1 to 2 weeks. So here you're saving around 4 weeks for the patient. And for example, a simple laborer who's earning 500 rupees per day, if you calculate this over 4 weeks, this 500 rupees in a week is 3,500. Over 4 weeks is 14,000 rupees saved per patient. And if you calculate only 50,000 surgery, 50,000 laborers we operate in a year, so that's around 700 crore rupees saved by this simple approach, which we are trying to adapt in India, and we're trying to bring a change. Now, coming to why this approach is and what is it? So basically, this is what is we call as direct anterior approach, in which we approach the hip from the front. The posterior approach or lateral approach is around 20 centimeters. So there is less blood loss. The patient is in the hospital for only 1 day. Now we are discharging the patient on the same day of surgery. So it is faster and it is better than any other approach. So now coming to the healthcare burden. India is burdened with a lot of patients. The healthcare system, we have poor penetration of insurances. So many patients are paying out of the pocket. They don't have insurance. So they're paying out of the pocket, and most of them cannot afford this surgery. So a DAA in these patients will be a game changer because the cost of surgery is less. They'll be not paying so much because the length of stay is less. They don't need much antibiotics, and they'll be able to walk same day and go home on the same day. Now coming to the advantage of robotics. So what robotics is doing is, robotics is just started in India maybe a couple of years back. You all must have heard how robotics is occupying most of our workstations, even medical, non-medical, other fields also. So robotics basically is a thing in which we are taking the help of the robotic arm to do the surgery. The robot actually is not performing the surgery. It is guiding the surgeon in performing the surgery. So the robotic arm is helping the surgeon in performing the planned surgery. So what we do in robotics is we do a CT scan of the patient. That CT scan is then uploaded on the robot, and it gives you a 3D bone model of the patient. So in this, we plan the whole surgery by doing a 3D mapping of the hip. Hip is mapped properly, and the implant selection, the placement, and the alignment is planned before the operation. So before I start operating, I know what implant I'm going to put, what implant is going to go where, and how it's going to balance. So this gives a better and a safer perspective for me to treat my patient because I'm already prepared with what consequences will happen. Now coming to why this robotic surgery is not being adapted in India until now. First of all, the DA and the robotic surgery is because the cost of the robot. As we all know that mobile phones initially were much costlier. The prices have come down eventually. With robot also, the things are improving. They're getting better and better rates. And as we scale up, the price will further come down. Now coming to direct anterior approach. So why this approach is a game changer is because it can give guaranteed results. We can do both the hips on the same day of surgery, and it can give exact alignment and balance on both the sides. So before, this approach was not very popular. We used to do from posterior, and this eliminated the patient from undergoing both the hips at the same time. So the usual interval the patient has both hips problem between two surgeries will be around 3 months. So in all, we're losing around 6 months on both. So that's a big issue. In DAA or direct anterior approach, we can do both of it on the same day, and we can perform the surgery using the same time, same anesthesia on the same day, one after the other, and the patient is walking within 4 hours of surgery. So that's how it is a game changer in India. And coming to this robotics, basically, you can scale it up like it's like Google Maps. If we all use Google Maps, right? For going from one place to another. Google Maps sometimes can go haywire, right? But robotics will not go haywire because the surgeon is in total control of the procedure. If something goes wrong, the surgeon can actually override and he can change. So as of now, robotics is actually adding values to our surgeons. And if you see the other countries like US and Europe, most of the surgeries over there are done with the anterior approach. Almost 70% centers are doing this surgery with anterior approach and robotics. And the same trend is trying to come to India. And the problem is bringing in India is the surgeons are not aware of this. We were never been taught of this approach, and it needed a special table, which is called as a HANA table. And this table is roughly costing 1.5 crore rupees. So to implement this in India, again, we're talking about cost saving, but on the other hand, the table is very costly. So to avoid this big cost, what we have done is we have made a new innovative technique. We have tweaked some steps, and we have done a few patented techniques in which we are doing this with out. So we don't need any special table, and we are able to the whole same surgery on a routine normal table of the operation theater, in which you don't need any special table, and so you're saving that 1.5 crore rupees. And we are now started training various surgeons for this. So what we need now is to train surgeons who can adapt to this direct anterior approach without the need of a direct of the HANA table, and that's how we can scale it up and bring more and more surgeons. So my target is, we want surgeons to learn this technique. So my vision is to train more and more surgeons. I have already trained around 100 surgeons with this technique from all over India, and we're getting surgeons from Malaysia, Australia, Singapore to come to our centers. We have made a center of excellence in Pune for hip replacement surgeries to learn this robotic assisted direct anterior approach surgery, and this is how we're doing it. And we are training them. So basically, with robot, the surgery is like math. The steps are fixed. So there's no variation. So all patients will get the same result. So the rich man or the poor man will get exact same result. So there is no discrimination, and we can offer same treatment all along. So that has been my goal, to get technology to the masses, and we get best results for all of them. So there's no discrimination, and there is standardization of all results in all patients. Now, coming to how we implement this. So we want India to be on the global map. We want India to be the medical Silicon Valley, so that we get patients from all over the world to come to India to learn this innovative technique. And we have started this so that patients are going home faster. We evolve our healthcare systems so that there's less burden for patients, especially for Ayushman Bharat. If you see, even if we save 2 days of stay in a hospital, it will reduce the burden of the finances on the government for reimbursement of these patients who are undergoing hip replacement surgeries. So one more thing is, we all want a patient who undergoes hip replacement surgery is he wants normal movements. He does not want to have restriction. So if you compare the direct anterior approach with other approaches, is when you do it with a posterior or a lateral approach, the patient is advised by most of the surgeons that you should not sit down, you cannot squat, you cannot use Indian toilets, you should not run, you should not do this, you should not do that. So that's what is happening. With direct anterior approach, there is no restriction because you are not cutting any muscle. The movements are complete. The patient is able to sit down on the floor. He's able to walk. He's able to use Indian toilets. He's able to do all his routine activities with minimal pain, and he's able to get back to his work early without much of financial burden. Also, we need more awareness among the patients. We need to train. We need to educate patients that this is what it is and this is how we want. We can give you better results. So if the patient is demanding better results, the system will evolve. Otherwise, we will continue doing the same old technique and we'll never evolve. So you my guys, are the future of India, the future in your fields. You maybe the next one will be designing the new AI, which will map surgeries better. You are the guys who may be, redesigning the recovery rooms for speed, for a faster recovery of the patients. And this is what we should educate more and more people about this. And we want you guys also to step up and think about what we can do in future. Also, the problem with the other surgeries is, the recovery time is very, very long, and patient is missing the work for almost 2 to 3 months. With DAA, the recovery is faster, and the patients are doing very well. So for me, what my ideal is, a treatment is effective when it gives peace of mind, body, and spirit without the worry of consequences. So robotics offers this peace of mind because it is eliminating the error which is there as far as human error. So robotic eliminates the human error, and the patient, we can give guaranteed result to our patients. Plus, the direct anterior approach is an approach which is a total intermuscular approach. We're not cutting any muscle. There is less bleeding, less pain, and the patients are able to do their routine activities with ease without much pain. So my take-home message for all of you is, I being a surgeon, I'm trying to get this wave in India. It's called as DA wave. I have treated around more than 8,000 patients with surgeries, and when I see my patients going home, walking without pain, with smiles on their face, the pain which they had for years together, that is what matters to me the most. And this is what I feel is we should target. And so that smile is the purpose. So I feel that when we are treating a patient, we're not treating a patient just for the joint. We're treating the patient as a whole. We want to give them good results, and this is not just medicine. It is purpose. It is my Gaston. So that's what I think we should do. So I'll show you a few examples. So this is one of the patients who we did a surgery. He could do a marathon after surgery, doing both hip replacements. And this is one patient. He himself is a doctor. He is practicing for triathlon after both the hip replacement. And this is what the pharma we operated. So this is immediately 2 weeks after surgery. He's able to do all his routine activities. He's able to do his agriculture activities in 2 weeks of surgery. This is also one lady who had terrible fused hips, could not walk. She's able to walk through surgery. She's able to do her routine activities. This is a 16-year-old boy with fused hips. He came to me with on stretcher. He was not able to walk. He missed his schooling. He could not give his board exams of 10. And he was on bed for 3 years and homebound for 3 years. Post surgery, he started walking and he's doing routine activity. Finished his schooling, finished his board exams. Now he's in his college. So this approach is a game-changing approach, and we're seeing fantastic results. Also, this one of the patients who's the dancer. He's doing his dance post surgery, and absolutely doing everything like normal. So hip arthritis is not the end of life. There is a cure to it. So you go to the right doctor, the right technique, and you can get the right results. So this is day zero recovery, day one recovery. Patient is walking, dancing in the hospital, able to do all his routine activities without much pain. So this is what it is. So thank you so much. India needs training. We are planning to train more and more surgeons from all over the world. We are getting surgeons from Asia Pacific region, from other countries, and that's how it's happening. So thank you.